What your poop means? About your poop may be a variety of sizes, shapes, and colors. It may sink or it might float. In this video, we will discuss all of this to help you determine what your poop means. Poop size. A normal stool size is ideally between 4 and 8 inches. Tiny poops aren't good. Poop shape. Often people use a variety of different terms when they talk about having a bowel movement. It can be difficult to describe your poop, so doctors created a scale to show the different types of poop. Your
Like, comment, subscribe.
food has spent a long time in your bowels and is difficult to pass. If your stool looks like this, you're probably constipated. If it lasts longer than a couple of weeks, see your doctor to find out what's causing it. This stool also can be a symptom that you're constipated. Eat more fiber and drink more water to ease your discomfort. This kind of poop is normal, it's soft and easy to pass. If things are functioning properly, then it won't take longer than a minute on the toilet to push out a poop. This is the ideal poop structure to have. People's bathroom routines are different, but typically you should have one of these every 1 to 3 days. This form of stool is easy to expel, but you may experience a sense of urgency and need to go to the bathroom ASAP. This is a sign of mild diarrhea. Typically, it goes away by itself in a couple of days. If you experience this more than 3 times a day, you have diarrhea. Make sure to drink plenty of fluids. Water is good, but you also need to replenish the electrolytes you're losing by drinking pure fruit juice, soups, or broth can help. This kind of stool moves through your bowel very quickly. See your doctor if you have more than 3 of these a day for longer than 2 days. You should check with your doctor if you also have other signs of dehydration, such as dry mouth, sleepiness, headache, or dizziness, severe pain in your tummy or rear end, or a fever of 102 degrees or higher. In general, your stool should be between firm and soft. Fortunately, you can determine this just by looking at it. You don't have to do a touch test. If your poop is a well-formed log and it wasn't too hard to squeeze out, it's probably the right consistency. The color of your poop generally reflects what you have eaten, whether that's food, beverages, or medicines. Normal poop color is brown and ranges in shades from tan to espresso. The brown color is primarily due to bile and bilirubin. Bile is a yellowish-green fluid made by the liver and stored in the gallbladder. Bilirubin is an orange-yellow substance that the body makes through the normal process of breaking down red blood cells. Through the digestive process, these fluids mix with your foods and usually make your poop brown. Although brown is the most common color, there are other colors you might see in the toilet. Here's what the color of your poop might mean about your health. Baby's poop is black for the first few days after they're born. But as for adults, there are a number of reasons why your poop may be black, including you ate a large amount of black foods like black beans or black licorice. Other causes of black poop are taking iron supplements or a bismuth medication like Pepto-Bismol. But black stool can also mean that you have bleeding in your upper gastrointestinal, the GI tract. Having internal bleeding is an issue, so if you can't figure out why your poop is black, call your doctor to make an appointment to discuss this issue. If your poop is a little greenish, it's totally fine. You're probably eating plenty of leafy greens like spinach, kale, or collard greens. And if your poop suddenly looks like neon green Play-Doh, the likely cause is artificial colors from drink mixes, bakery frosting, or eating too many frozen foods that have food coloring or dyes in them. If you have green diarrhea, the color of your food may not be to blame. It's likely that your meal moved through your gut too quickly, so the fat-digesting bile didn't have time to turn it brown. There may be instances when your stool looks more yellow than brown, but if your poop is yellow, greasy, and foul-smelling, it means that you've been eating too much fat. But sometimes it can be a symptom of malabsorption, which means that your body isn't able to pull nutrients from food during digestion. Malabsorption can occur due to illness, food intolerance, or diseases that affect the intestinal lining. There are dietary reasons why your poop may turn red, like drinking tons of red juice like tomato juice or Hawaiian punch. Your poop could also be red from eating lots of beets, cranberries, red gelatin. But red poop can be a cause for concern because it may mean you have bleeding in your colon. This can be a sign of colon cancer or digestive disorders. Bloody stool may look coated in red, or you may notice spots of red in it. If you can't explain the red color by your food choices, schedule an appointment with a primary care doctor. Poop can often come out the color of the food that went in, especially if you have diarrhea. If your poop has an orange hue, it's most likely due to some orange foods such as carrots, squash, or sweet potatoes. Chalky poop is scary to experience. It may mean your body isn't producing bile. It could be that you have an infection or that your bile duct is blocked. Pale poop could also be a side effect of medicines, including some meds that are used to treat diarrhea. Timing of bowel movements. The most natural time to poop is in the morning after your body worked overnight processing your food. But there's nothing wrong with having bowel movements at other times of the day. How long it takes you to poop. It should take just a couple minutes for you to have a bowel movement, certainly not more than 10 to 15 minutes. If there's pain or straining to get your poop out, you're probably constipated. How often should you poop? You don't need to poop every day to be regular. It's normal and healthy to have a bowel movement anywhere between 3 times a week to 3 times a day. If you're producing soft, well-formed logs that aren't hard to push out, your bowels are probably in good shape. Poop doesn't smell like a rose garden. So, if your poop stinks, congratulations, you're normal. But if the smell of your poop makes your eyes water, that's not normal. Most likely it's due to an infection. In some cases, foul-smelling feces happens when your body is unable to process gluten or other nutrients. If you notice that your poop smells horrible after you eat certain things, you should talk to your doctor, especially if you're experiencing unexplained weight loss too. Should poop sink or float? Generally, poop sinks. But if your poop floats, it's typically not something to be concerned about. Floaters are often caused by excess gas from eating things like beans or sugar-free candies. But if you experience floating poop that is also stinky, it can be an indication that your body isn't processing food correctly because you have an infection, food intolerance, a digestive disorder, or other medical condition. Major changes in your bowel movements or the look of your poop can be a sign of a medical condition that requires medical treatment. Maintaining good health and good poop can depend on several factors, including diet, exercise, overall health, medications, and stress. But lifestyle factors such as diet and exercise can go a long way toward ensuring good bowel movements over and over again. Like, comment, subscribe. See you next time.
We release new videos every Thursday, Friday, Saturday, and Sunday. Subscribe now so you never miss a video. Thank you for watching and see you next time.